Hello everyone. In today's session, we'll tackle 75 NCLEX questions that are commonly seen on the exam. And these will help you focus on the core topics that are vital for success. And by reviewing these, you'll not only boost your confidence, but also enhance your likelihood of acing the NCLEX on your first attempt. Let's get started with question number 1. The nurse is educating a client newly diagnosed with hyperthyroidism about the purpose of propylthiouracil. Which statement by the client indicates the need for further teaching? A. This medication will help decrease the production of thyroid hormones. B. I will need regular liver tests while taking this medication. C. I can continue eating iodine-rich foods like seafood and iodized salt. And D, if the medication works, I may notice my heart rate slowing down. The correct answer in this question is letter C. This statement reflects misunderstanding of the dietary restrictions that must accompany hyperthyroidism management. And take note that consuming iodine-rich foods can stimulate the thyroid gland and counteract the effects of PTU, which aims to suppress thyroid hormone production. Also, food items such as seafood, seaweed, and iodized salt are high in iodine and should be avoided or consumed with caution in individuals with hyperthyroidism. So our incorrect answers include letter A. This statement is basically reflecting understanding. We know that propylthiouracil is an anti-thyroid medication that inhibits the synthesis of the thyroid hormones by interfering with the enzyme thyroid peroxidase, which is very important for the production of T4 and T3. Now, going back to the PTU, this is a drug that also inhibits the peripheral conversion of T4 to the more active T3. And this statement aligns with the therapeutic purpose of the medication, so it indicates proper understanding. So when you're faced with this type of question, you have to look for a statement that contradicts the purpose of PTU. So you eliminate this option. For letter B, again, another incorrect answer here. This statement reflects an accurate understanding of the medication's side effects and necessary precautions. So recalling that PTU has been associated with hepatotoxicity, including the potential for severe liver injury. So in here, regular monitoring of liver function through the blood tests such as the ALT, AST, and bilirubin levels is essential during the treatment to detect liver damage early. And letter D is also incorrect because this is a statement that reflects the client's awareness of this outcome, and it indicates proper understanding of the medication's effects. And we know that with hyperthyroidism, it can cause symptoms like tachycardia due to increased thyroid hormone levels, which can enhance metabolic activity and sympathetic nervous system effects. So by decreasing the thyroid hormone production, PTU can help normalize the metabolic rate, and it can potentially lead to a reduction in the heart rate. So, correct answer here is letter C. We are looking for that statement that reflects misunderstanding that will require your further teaching. Let's have number 2. A client with ulcerative colitis is experiencing an exacerbation. Which intervention should the nurse prioritize? A. Encourage a high-fiber diet to promote gut health. B. Administer prescribed corticosteroids as ordered. C. Position the client flat to reduce abdominal pain. And D. Promote a high-protein diet with fatty foods to regain energy. The correct answer here is letter B, because corticosteroids are often prescribed during exacerbations to reduce inflammation in the colon. And we have letter A as one of the incorrect options because high fiber diets may worsen symptoms during an exacerbation by irritating the inflamed mucosa. And so in this test question, you have to identify interventions that align with the acute phase of the condition rather than general health. And you have to eliminate interventions that may aggravate inflammation or increase symptoms during exacerbation. For option C, positioning the client flat does not directly alleviate abdominal pain related to colitis. We know that semi-Fowler's position can be more beneficial for reducing the abdominal pressure, and it can promote comfort. But positioning alone will not address the root cause of the inflammation or the symptoms. Now, for letter D, another incorrect option, we know that high-protein diet may support healing during remission phases, but fatty foods are contraindicated during exacerbation because these food items can irritate the colon, it can exacerbate symptoms, and can worsen diarrhea. So you need to keep in mind, make sure that you recognize the dietary contraindications during exacerbation. So avoid foods that can worsen inflammation or irritate the mucosa. And you gotta eliminate those options suggesting diets that include irritants such as fats or fiber when managing acute symptoms. Question number 3. A client with ulcerative colitis is experiencing dehydration due to diarrhea. Which nursing diagnosis is most appropriate? A, risk for infection. B, deficient fluid volume. C, impaired skin integrity. And D, imbalanced nutrition more than body requirements. The correct answer is letter B. This is the most appropriate diagnosis, as diarrhea from the ulcerative colitis can lead to dehydration and electrolyte imbalances. So you need to prioritize diagnoses that match the primary cause of the client's symptoms, and you got to look for those clues in the question, such as the dehydration due to diarrhea, in order for you to identify the focus of the nursing intervention. Now, one of the incorrect answers here is letter A. We know that clients with ulcerative colitis may have a risk of infection, especially if they are on immunosuppressive therapy like corticosteroids. This is not the priority diagnosis for a client with a dehydration due to diarrhea. And addressing dehydration, which is a physiological need, takes priority over potential risks. And you got to use that Maslow's hierarchy of needs. You have to address those physiological problems. And here we have identified that it's dehydration before risk-related issues like infection. So again, eliminate options that address potential rather than actual concerns. Another incorrect option here is letter C, impaired skin integrity. This might apply if the client's diarrhea causes perianal irritation or breakdown. However, this is a secondary concern compared to the immediate threat of dehydration, and restoring fluid balance takes precedence over skin integrity issues. So keep in mind. Now, letter D, imbalanced nutrition more than body requirements, is also incorrect because clients with ulcerative colitis typically experience weight loss and malnutrition, not overnutrition. And malabsorption, poor intake, and increased metabolic demands during exacerbations make this diagnosis irrelevant. And again, you got to eliminate options that are inconsistent with the typical clinical presentation of the ulcerative colitis. Number 4, during a routine check, the nurse knows that a client receiving TPN and fat emulsions has developed a fever and chills. What should the nurse do first? A, stop the infusion immediately. B, notify the primary healthcare provider. C, assess the infusion site for signs of infection. And D, reduce the infusion rate until the client stabilizes. The answer is letter A. When your client develops fever and chills while receiving TPN and fat emulsions, this may indicate bloodstream infection or possibly sepsis, and this is often caused by contamination of the TPN solution, or central line infection. As a priority action, you immediately stop the infusion to prevent the infusion of potentially contaminated fluids, which could worsen the client's condition. And letter B, one of the incorrect answers here, this is an important intervention, but it is not the first action this time. So immediate measures such as stopping the infusions is actually going to be much more of a priority to address the potential source of harm before contacting the provider for further orders. So remember this, you gotta stabilize the client first before escalating to the primary healthcare provider. Again, you initiate actions that reduce harm or manage symptoms. And here you have to eliminate notify options when immediate interventions are required. Letter C, another incorrect answer or option. Assessing the infusion site is important for identifying local signs of infection such as redness, swelling, or drainage. However, this action is secondary to stopping the infusion, as the primary goal is to prevent further systemic exposure to potential contaminants. Now, assessments are often secondary to immediate interventions when a client is showing signs of distress. And you got to prioritize actions that prevent further harm over gathering additional data. Letter D, another incorrect option, which is reduce the infusion rate until the client stabilizes. Well, this is not appropriate in this situation. It does not eliminate the potential source of infection, nor does it address the urgent need to stop the infusion entirely. And so this option does not really align with the best practices for managing complications of TPN. Again, your clue here is to eliminate options that delay critical actions or fail to directly address the source of the problem. And you have to recognize that partial measures such as reduce rate are rarely sufficient in emergencies such as this one. We have question number 5. The nurse is caring for a client with a type 1 diabetes mellitus who reports consistent hyperglycemia around 5 to 6 a.m. The nurse recognizes that this is most likely caused by A, insufficient nighttime insulin, B, the release of growth hormone during the night, C, a bedtime snack that was too high in carbohydrates, and D, increased physical activity during the day. The answer is letter B. The dawn phenomenon is actually caused by the release of the growth hormone, cortisol, and catecholamines during the night, which increase insulin resistance, and this will lead to hyperglycemia in the early morning. This is the most accurate explanation for the client's hyperglycemia. And so letter A is an incorrect option. While insufficient nighttime insulin could lead to hyperglycemia, this is not the most likely cause of early morning hyperglycemia, because the dawn phenomenon is caused by hormonal changes rather than a direct deficiency of insulin. And so adjusting the timing or type of insulin might help manage the hormonal surge, but this option oversimplifies the issue. And so when you are selecting the option here, you got to be cautious of answers that describe potential effects without addressing the underlying cause. So you need to understand the difference between the dawn phenomenon and insulin insufficiency. Now, option C is another incorrect option here. While a high carbohydrate bedtime snack can cause elevated glucose levels, this is not the primary cause of the dawn phenomenon. Now, the key distinction here is that morning hyperglycemia in the dawn phenomenon occurs due to hormonal influences regardless of food intake. Again, as a strategy, you need to differentiate between diet-related hyperglycemia and hormonal-driven hyperglycemia. And in this test question, you need to eliminate those options that misinterpret causative factors. Option D is also incorrect. We know that physical activity during the day is unlikely to cause early morning hyperglycemia, but in fact, regular activity often improves glycemic control by enhancing insulin sensitivity, and this option is irrelevant to the timing and pathophysiology of the dawn phenomenon. Let's have number 6. The nurse provides discharge teaching for a client with sickle cell disease. Which statement indicates the client understands how to prevent future vaso-occlusive episodes, or VOEs? A. I will avoid drinking too much water to prevent overhydration. B. I should avoid strenuous exercise and stay warm in cold weather. C. I will take ibuprofen daily to manage pain even if I don't have a crisis. And D. I can drink alcohol as long as I stay hydrated afterward. The correct answer is letter B. Strenuous exercise can increase oxygen demand, it can worsen hypoxia, and cold weather can also lead to vasoconstriction. And so both of which are triggers for the vaso-occlusive episode. So avoiding these triggers is a critical preventative strategy for clients with the sickle cell disease. And so we have letter A as one of the incorrect options here. This is a statement that reflects misunderstanding of the sickle cell disease management. We know that with adequate hydration, it is very important to have this to reduce the risk of vaso-occlusive episodes, because dehydration can increase blood viscosity, which can also lead to sickling and also can promote vascular blockages. And so the overhydration is not a common concern unless a client has a coexisting condition such as renal or heart failure. And so you need to eliminate options that will contradict the fundamental management principles of this sickle cell disease. Now, we have letter C as one of the incorrect options. So the daily use of the ibuprofen without a specific indication is not recommended due to the potential adverse effects such as gastrointestinal irritation, and can also lead to renal damage. Now, for pain management, this is another priority issue or intervention that should also be done to mitigate the patient's manifestations. But here, it's stating that even if the patient is taking daily ibuprofen to manage pain, even if I don't have a crisis. So this is really a misleading statement. We have letter D. I can drink alcohol as long as I stay hydrated afterward. We know that alcohol can trigger major events such as the VOEs. So even with hydration, the alcohol can actually exacerbate complications of SCD, such as liver damage or poor circulation. So you have to be cautious of answers that suggest balancing harmful behaviors with compensatory actions such as drinking alcohol and then hydrating. Let's have number 7. A client receiving total parenteral nutrition and fat emulsions has an infusion running 1 hour behind schedule. What is the nurse's best action? A. Adjust the infusion rate to make up the difference over the next hour. B. Increase the infusion rate to ensure the infusion finishes on time. C. Confirm the fat emulsion infusion is running at the prescribed rate and maintain that rate. And D. Stop the infusion and notify the primary healthcare provider. The answer here is letter C. This is the safest and most appropriate action. And take note that ensuring the infusion runs at the prescribed rate minimizes the risk of complications such as fat embolism, hyperglycemia, or possible overloading of the circulatory system. So any adjustments to the infusion schedule must be made only under the guidance of the primary healthcare provider. And so you have to select that option that emphasizes adherence to prescribed orders and prioritize client safety. Now for letter A, this is an incorrect option. because if you're rapidly adjusting the infusion rate to catch up, can lead to, again, fluid overload. This can also lead to hyperglycemia, possible fat embolism. And we know that TPN and fat emulsions are specifically prescribed to be administered over a set time to avoid metabolic complication. And so this action is inappropriate and unsafe. Now, one clue for you in this test question is to eliminate actions that involve rushing infusions or altering prescribed rate, as these can cause harm to our patient. Letter B is an incorrect option as well, because increasing the infusion rate beyond the prescribed rate can cause complications similar to option A, can lead to hyperglycemia, fluid overload, or possibly fat embolism as well. And so again, we need to follow the prescribed infusion rate to prevent adverse events. Now, letter D is another incorrect option. Stopping the infusion unnecessarily disrupts the client's nutritional therapy and could lead to hypoglycemia or nutritional deficits, especially in clients dependent on TPN for caloric intake. Now, stopping is not indicated unless there are clear signs of complications such as allergic reaction or possible sepsis. And for you to carefully answer this question, eliminate those answers that suggest unwarranted actions such as stopping therapy without clear and immediate reason. Number 8, the nurse is reviewing the labs of a child who has recently had oral surgery. Which of the following lab results should the nurse prioritize? A, blood urea nitrogen level. B, prothrombin time. C, creatinine level. D, viral load. The answer is letter B. The prothrombin time is a crucial indicator of the blood's ability to clot. And following oral surgery, the risk of bleeding is heightened, especially if the client has had a history of coagulation disorders or possibly on anticoagulant therapy. So monitoring the prothrombin time allows you and the team to intervene promptly if the clotting issue occurs. Now, letter A is an incorrect option here because the BUN is primarily used to assess kidney function unless there is a specific concern about dehydration, renal impairment maybe, or possible medical toxicity. BUN is not a priority after oral surgery. So eliminate this option. Letter C, creatinine level. So this is same to option A. Creatinine is also a marker of kidney function, and it's not routinely monitored following oral surgery unless there is a concern about nephrotoxic medications or any underlying renal condition. So you have to discard this option. Letter D, viral load, is a testing that is specific to clients with conditions such as HIV or hepatitis to monitor the activity of the virus, but it has no relevance to the routine post-op care of a child who has had oral surgery. So eliminate this option as well. Let's have number 9. The nurse observes the client demonstrating palmar flexion while inflating a blood pressure cuff. Which of the following actions should the nurse take next? A, obtain the client's calcium level. B, ask the client about recent episodes of dizziness. C, monitor the client's blood pressure using a thigh cuff. And D, check the client's capillary refill time. The answer is letter A. The palmar flexion during the blood pressure cuff inflation is the classic true Sue sign, which is an indication of hypocalcemia. And this will require much more investigation by checking the patient's calcium level to confirm or to rule out electrolyte imbalances. Now, letter B is an incorrect option here. We know that dizziness may occur with any electrolyte imbalance or possibly related to hypotension, but it's not directly related to the Trochu sign. And this response does not prioritize addressing the immediate abnormal finding. Now, letter C is also another incorrect option because using a thigh cough for blood pressure monitoring may be appropriate in specific circumstances, maybe an arm injury or obesity, but it does not address true sign or the underlying issue. And so this action is also irrelevant. Now, your clue here is to discard any option that do not connect to the abnormal clinical sign that is observed in the case. For letter D, another incorrect option, the cap refill time only assesses peripheral perfusion and circulation, but will not be relevant to the observed pulmoflexion or the suspected hypocalcemia. It does not provide any diagnostic information for the abnormal sign that we are seeing here. And again, you have to eliminate those options that assess unrelated parameters instead of addressing the observed sign. Let's have number 10. The nurse is providing discharge instructions to a client with chronic low back pain. Which client statement indicates the need for additional teaching? A, I plan to quit smoking to help improve my back health. B, I will start sleeping on my stomach to ease my back pain. C, I purchased a firm mattress to support my back properly. And D, I'll make sure to bend my knees when I lift heavy items. The answer here is letter B. We're looking for that statement that requires further teaching. So, sleeping on the stomach, or let's say prone position, can increase lumbar lordosis, which can exacerbate back pain by placing induced stress on the lower back. And so the optimal sleeping position for back health are lying on the back or possibly side lying with a pillow between the knees to maintain natural curve of the spine. So when you encounter this type of question, you have to look for statements that demonstrate incorrect or harmful actions that contradict medical advice or established best practices. So in this case, sleeping on the stomach is inappropriate for managing back pain. Now, for letter A, one of the incorrect options here, smoking cessation is very beneficial for individuals with chronic low back pain. And we know that nicotine can impair blood flow to the intervertebral disc. So this can also contribute to the degeneration and worsening of the pain. And so this is a statement that reflects understanding. You have to eliminate this one. Letter C, I purchased a firm mattress to support my back properly. Again, this is a statement that reflects understanding. This is reflecting that they understood that a firm mattress can provide proper body support by keeping the spine aligned and relieving pressure on the muscles and ligaments of the back. We have letter D, another incorrect option. This is stating, I'll make sure to bend my knees when I lift heavy items. This is basically a correct statement that is a component about proper body mechanics. So this is going to reduce the stress on the lower back, and it can also prevent injury or further injury. And this statement is basically indicating proper lifting technique. So you have to discard this option. Number 11. What is the most appropriate nursing action after a client has undergone a lumbar puncture? A, encourage early ambulation to prevent complications. B, position the client flat for several hours. C, monitor the client for signs of petechial rash. And D, assess the client for knuckle rigidity. The answer here is letter B. So if you have a patient who has just completed a lumbar puncture, they are supposed to be positioned flat for several hours, let's say 4 to 6 hours, in order to minimize the risk of a post-dural puncture headache. And this is a headache that can occur whenever there is CSF leaking from the puncture site, leading to a decreased pressure around the brain. And so we need to keep the patient flat to prevent this from happening by allowing the puncture site to heal. Now, letter A is an incorrect option. So when you are promoting early ambulation, this is not recommended immediately because it can increase the risk of post-dural puncture headache, and it can lead to cerebrospinal fluid leak. Now, letter C, monitor the client for signs of petechial rash. So what is this? This is another incorrect option here. Whenever there is a petechial rash, this might indicate that there's a bleeding disorder or maybe an underlying condition such as meningococcal infection, but it is not a primary concern directly related to the lumbar puncture procedure. And also monitoring for a petechial rash would be relevant if the client was at risk for infection or maybe a clotting disorder, but it's not a priority in this scenario. Now, letter D, assess the client for knuckle rigidity, which is basically the stiffness of the neck. And this is going to indicate meningeal irritation or possibly meningitis, but it is not a common complication immediately after a lumbar puncture. And what you should be, you should recall that post-lumbar puncture care should focus on positioning and managing the complications directly related to the procedure itself, such as headaches due to the CSF leakage. Let's have number 12. The nurse is teaching a client about newly prescribed metoclopramide for nausea and vomiting. Which adverse reaction requires immediate follow-up? A, dystonia. B, fever. C, drowsiness. D, diarrhea. The answer here is letter B. That is fever, especially when associated with other symptoms such as muscle rigidity, tachycardia, because this can indicate neuroleptic malignant syndrome, or what we call as NMS, which is rare but actually a serious and potentially fatal condition. Now, take note that we're talking about metoclopramide, which is a dopamine antagonist, which can trigger neuroleptic malignant syndrome, which requires immediate medical attention to prevent severe complications or possibly death. And again, fever is a hallmark sign of neuroleptic malignant syndrome, and this is an urgent condition that you need to intervene. Now, letter A, dystonia, is an incorrect option. This is basically the spasms, muscle spasms, or possibly abnormal muscle tone. This is a known adverse effect of metoclopramide and often occurring after the medication is administered. However, the dystonia is distressing. We know that, but it is not as life-threatening compared to the fever, which is a hallmark sign of the NMS. Now, it doesn't mean that you're gonna neglect this, but you have to report this condition to the healthcare provider. But again, not as critical compared to the fever in the NMS. We have letter C, drowsiness, which is another incorrect option. This is a common side effect of the metoclopramide, and this can typically resolve with time as the body adjusts to the medication. Now, we know that this can impair the patient's ability to perform tasks such as driving, but it is not an emergency condition and does not really require immediate follow-up. Now, letter D, diarrhea. What is this? This is another potential side effect of metoclopramide, but it is not a critical reaction that requires immediate follow-up unless it becomes severe or it becomes persistent. So your role here is to monitor for their hydration status and advise the client to contact the healthcare provider if the diarrhea becomes uncontrolled or if it leads to the dehydration. Now, in order for you to select the correct option in this question, you need to prioritize the symptoms that suggest life-threatening complications such as fever with muscle rigidity, especially that we are talking about metoclopramide. Question number 13 will follow after this. And so we are inviting you to join and also enroll to our Stancoast NCLEX Coaching. This is the course that we're offering, and so it has 300 hours of engaging animated videos, lessons, and also on-demand videos for flexible learning. We have about 10,000 practice questions to sharpen your skills in selecting the correct answers, and also audiobook. We got ebook. And other than that, we also have the mock test, computer adaptive test, and test series to simulate the real exam. And together with that, we also have the 200 plus next generation NCLEX questions for your comprehensive preparation. And this is something that you can access for the entire 12 months. So kindly visit our website at Stancoast, nclexcoaching.com to avail your course. And so let's proceed with our question number 13. A nurse is assessing a client using the cut, annoyed, guilty eye, which is known as the CAGE questionnaire. Which client response would require further evaluation for alcohol use disorder? A. I sometimes feel the need to cut down on my drinking. B. I prefer to drink wine rather than beer. C. I only drink alcohol socially with friends. And D. I started drinking alcohol when I turned 21. The answer is letter A. This is a response that directly aligns with one of the 4 questions in the CAGE questionnaire used to screen for possible alcohol use disorder. And so if a client indicates they feel the need to cut down, it suggests concern about their drinking habits and warrants further evaluation. So here you got to pay attention to the keywords cut down, as this is reflecting one of the CAGE questions, making it the most relevant option. Now, letter B is an incorrect option. The type of alcohol consumed does not determine whether someone has an alcohol use disorder. And so this response is unrelated to the CAGE questionnaires purpose of identifying problematic behaviors or feelings associated with drinking. And you have to eliminate responses that focus on alcohol preference rather than problematic use or emotional impact. Now, letter C is another incorrect option here, because social drinking alone does not necessarily indicate alcohol use disorder. And so further evaluation would only be needed if the client reported adverse consequences or problematic behaviors associated with their drinking. Now, letter D, another incorrect option. The age at which someone starts drinking is not an indicator of alcohol use disorder by itself. And just to review on the CAGE questionnaire, it does not assess when drinking began, but rather focuses on the consequences and feelings associated with drinking. And don't forget about the CAGE. Let's have number 14. A client with sickle cell disease is experiencing a vaso-occlusive event. Which assessment finding requires immediate intervention by the nurse? A. Pain rating of 7 out of 10 in multiple joints. B. Swelling and warmth in the hands and feet. C. Oxygen saturation of 89% on room air. And D. Skin tenting noted over the clavicle. The answer is letter C. We know that hypoxia, indicated by the patient's 89% saturation, is a critical finding because it can exacerbate sickling of the red blood cells, and we know that sickled cells can obstruct the blood flow. It can lead to tissue ischemia and also organ damage and worsening of the vaso-occlusive crisis. And you have to really intervene by administering oxygen supplementation to prevent progression. Now, delaying the intervention can also lead to acute chest syndrome, which is another life-threatening complication in sickle cell disease. Now, letter A is an incorrect option because pain is a hallmark symptom of a vaso-occlusive event caused by the tissue ischemia and inflammation due to sickle cells. We know that pain relief is important for the comfort and to reduce stress but it is not life-threatening compared to our option C. And again, pain is not typically the highest priority unless it affects A, B, C's, your airway, breathing, and circulation. Take note about letter C. This is a circulation issue. Now, letter B, swelling and warmth in the hands and feet. The swelling and warmth in the hands and feet, known as dactylitis, are a common manifestations in the vaso-occlusive event due to the blood vessel occlusion and inflammation. So this indicates poor circulation, but does not require immediate intervention compared to hypoxia. This is a chronic thing. Now, letter D, skin tenting noted over the clavicle. This is a sign of dehydration, which contributes to sickling. We know that hydration is an important intervention to improve the circulation and reduce sickling, but it is not as critical as restoring the patient's oxygenation. Now, take note about the issues that you will encounter in a patient that may have a sickle cell crisis here. So you might encounter a patient might be dehydrated or possibly with a poor oxygenation. You have to address first the circulation, of course, the airway, breathing, and circulation in that order. Let's have number 15. What should the nurse prioritize during the care of a client with a femoral vein catheter? A, monitoring for signs of infection such as redness or purulent drainage. B, ensuring the client is on fluid restriction to prevent complications. C, encouraging the client to ambulate frequently to prevent thrombosis. And D, replacing the dressing daily to maintain sterility. The answer is letter A, because infection is a primary concern for clients with central venous catheters, including femoral vein catheters. And these catheters provide a direct access to the bloodstream, so it can increase their risk of catheter-associated bloodstream infections, or known as the CLABSIs. Now, an early sign of infection can possibly be redness, swelling, there could be purulent drainage, and systemic signs like fever, and you have to monitor for these findings, which will allow you to promptly intervene to prevent sepsis. Now, you have to always prioritize infection prevention in clients with invasive devices, such as this one. Now, letter B is an incorrect option because fluid restriction is not standard practice for clients with femoral vein catheters unless there is a specific medical indication, such as heart failure or maybe renal impairment. And restricting fluids unnecessarily can lead to the dehydration, and it can increase the risk of catheter occlusion as well. Now, letter C is also another incorrect option. Ambulation is encouraged to prevent complications such as venous thrombosis. However, there is a catch. You must ensure the catheter is secure to avoid dislodgement. And so preventing infection takes priority over promoting ambulation. Now, letter D, another incorrect option. The daily dressing changes are not recommended because they increase the risk of exposure and also contamination. And so the dressing changes are typically performed per protocol around 7 days, every 7 days, or as needed when there is compromise to the dressing to maintain sterility while minimizing exposure. So you have to follow evidence-based guidelines to reduce infection risk, especially when you're dealing with a central venous catheter. Let's have number 16. A nurse is evaluating a diabetic client's morning blood glucose levels. Which intervention would most likely help prevent the dawn phenomenon? A, administering an increased dose of short-acting insulin at bedtime. B, in giving the evening dose of intermediate-acting insulin at 10 p.m. C, advising the client to consume a bedtime snack. And D, decreasing the client's insulin dose to prevent hypoglycemia. The answer is letter B. Giving the the intermediate acting insulin at 10 p.m. is the best answer here. Now let's go back into what the dawn phenomenon is. Again, this is that phenomenon that is caused by the release of counter-regulatory hormones. And we are talking about the cortisol, the growth hormone, during the early morning hours, which can increase the glucose production. Now, when you are adjusting the timing of intermediate acting insulin, such as an NPH, to 10 o'clock in the evening, it can allow it to peak in the early morning around 4 to 8 hours after the administration. So it will counteract this hyperglycemia. And so again, this is the most effective intervention to prevent morning hyperglycemia in dawn phenomenon. Now, we have letter A as one of the incorrect options. Short-acting insulin, such as a regular insulin, has a short duration, and it will typically peak within 2 to 4 hours, and it will not last throughout the night, so it would not prevent the blood glucose rise caused by the dawn phenomenon, which occurs in the early morning hours. Now, letter C is another incorrect option. A bedtime snack can help prevent the Somogy effect, which is another phenomenon. And we know that the Somogy effect is the rebound hyperglycemia after nocturnal hypoglycemia. And again, we are dealing with dawn phenomenon in this scenario. Okay. Now, letter D, another incorrect option. The dawn phenomenon is caused by insufficient insulin coverage during the early morning, and so decreasing the insulin would worsen hyperglycemia rather than improving it. Let's have number 17. Which of the following is a priority nursing action when caring for a client before starting propylthiouracil, or the PTU? A, teach the client to avoid iodine-rich foods. B, assess the client's liver function tests. C, assess for changes in thyroid hormone levels weekly. And D, advise the client to take the medication with meals to avoid gastric upset. The answer is letter B. Why? It's talking about assessing the client's liver function test. We have a patient that is supposed to start propylthiouracil. Now, take note that this medication has a black box warning for hepatotoxicity, which can progress to the liver failure if not detected early. So when you encounter this type of question, especially with PTU, you need to have that baseline LFTs level, okay? Make sure that you have that information, and this is something that should be assessed to identify any pre-existing liver function disorders, and this is something that should be done regularly after the patient has taken the medication. So the LFTs will be monitored regularly to detect any increase in the LFTs. Now, option letter A, which is an incorrect choice, is stating teach the client to avoid iodine-rich foods. Yeah, we know that this is a very important action, right? Or teaching, because we know that iodine can interfere with the thyroid function, and the action of PTU, this is not the priority nursing action. However, we have to assess and also monitor the effect of the PTU. Now, letter C is an incorrect option here. It states assess for changes in thyroid hormone levels weekly. Now, we know that this is very important, especially with T3 and T4, but these levels do not typically change on a weekly basis. And so the LFT monitoring is more critical due to the life-threatening risk of hepatotoxicity. Now, letter D is an incorrect option also. So taking the PTU with meals will minimize gastric irritation, but this is a secondary concern compared to assessing the patient for its baseline liver function test. Let's have number 18. The nurse is caring for a client in a vaso-occlusive event due to sickle cell disease. Which nursing action demonstrates effective care? A. Applying tight bandages to prevent swelling. B. Keeping the room temperature cool and well ventilated. C. Monitoring urine output to assess hydration status. And D. Encouraging the client to take deep breaths only when in pain. The answer is letter C. We know that adequate hydration decreases the blood viscosity, so to prevent further sickling of the red blood cells. And here you have to monitor the urinary output, which is a reliable way to evaluate hydration status. Now, the clue here is that when the question asks for effective care, especially in a vaso-occlusive event, again, your management here should focus on hydration, oxygenation, and circulation. And again, C is our most critical nursing action to reduce sickling and improve outcomes. Now, letter A is an incorrect option here. The tight bandages can restrict the blood flow, and this will exacerbate the VOE and can worsen tissue ischemia. So what we should do here as nurses, we have to maintain proper circulation to reduce complications. Letter B is another incorrect option because cold temperatures can cause vasoconstriction. This can reduce the blood flow. It can worsen the sickling. We better have to provide a warm environment to support circulation and comfort. Now, letter D is another incorrect option. Deep breathing should be encouraged regularly, not only when the client is in pain. We know that this is going to improve oxygenation and also reduces the risk of atelectasis, which is also critical in the VOE. Number 19. The nurse observes that a TPN infusion is cloudy with visible particulate matter. What is the appropriate action? A. Stop the infusion and obtain a new TPN solution. B. Shake the bag gently to mix the solution thoroughly. C. Administer the solution as ordered and monitor the client closely. And D. Notify the pharmacy and request a replacement TPN solution. The answer is letter A, because cloudy TPN with visible particulate matter suggests that there is contamination or possible precipitation, which can cause embolism, and it can also lead to sepsis. So you gotta stop the infusion immediately to ensure the patient's safety. Now, the presence of that particulate matter is basically going to be it is telling us that the TPN bag itself is already contaminated, so it is unsafe. And when you encounter this type of questions involving patient safety, your immediate action should to stop this harm, stop the infusion. This is a priority. So you got to eliminate answers that delay any action. Now we have letter B. This is an incorrect option. Shaking is not going to resolve the issue, and this will further disperse the particulate matter, which will increase the risk of embolism. So you got to discard this one. Letter C, another incorrect option. Administering a potentially contaminated solution can also place the patient at a higher risk for embolism, and this is not going to address the safety of our patient. Letter D, another incorrect option. Notifying the pharmacy is necessary, but after you have already stopped the infusion. So you have to ensure immediate client safety in order to promote top safety for your patient, I should say. Number 20, the nurse is preparing to feed a client on aspiration precautions. Which intervention is a priority? A, placing the client in a side-lying position during the meal. B, encouraging the client to eat soft foods with mixed textures. C, ensuring suction equipment is readily available. And D, allowing the client to drink water while lying flat to avoid fatigue. Take note about our case. It's talking about aspiration precautions. The answer here is letter C. So having that suction equipment at the bedside will allow you to take on an immediate response, such as whenever choking can occur, or maybe if there is an aspiration going on. And so this is very critical for this type of client, especially when they are at higher risk for aspiration. And so your clue in the SAS question, this is on aspiration precautions. So you have to prioritize actions that ensure client safety in case of aspiration. So again, make sure that you have this equipment. Now, we have letter A as one of the incorrect options. The sideline position is not safe for feeding, and this can increase the patient to aspiration. And so they should be placed in an upright position during the mealtime. Take note of that. Letter B is another incorrect option because mixed textures can be more difficult to swallow, and this can also increase their risk of aspiration. And so the food choices should align with the client's specific swallowing needs. Now, letter D is another incorrect option. Drinking water while lying flat can also increase the aspiration risk. So please take note, whenever you have a patient that is at risk to aspirate, make sure that they are placed in an upright position. And every oral fluid intake. Let's have number 21. The nurse is preparing to administer an IV dose of metoclopramide. What is most important action to prevent adverse effect? A, administer the medication rapidly to achieve quick results. B, mix the medication with dextrose 5% and administer over 5 minutes. C, administer the medication slowly over 1 to 2 minutes. And D, dilute the medication in normal saline and administer as a bolus. The answer is letter C. You have to slowly administer this medication to minimize the risk of adverse effect, particularly extrapyramidal symptoms. And you gotta administer this medication over 1 to 2 minutes. Now, the clue to this question is that most important action to prevent adverse effect, which prioritize the method of administration. And so the slow delivery of the medication known to cause side effects can reduce this from happening. Now, we have letter A as one of the incorrect options. The rapid administration will place the patient at risk to developing the extrapyramidal effects, which includes the dystonia, agitation. Now, we have letter B, mix the medication with dextrose 5%, administer over 5 minutes. We know that diluting the medication is acceptable, but there is no requirement to mix metoclopramide with dextrose 5%. And in addition to that, the standard recommendation is to administer it over 1 to 2 minutes, not longer. Letter D is another incorrect option. We know that administering the medication as a bolus can lead to a rapid exposure of the drug, and it will lead to an increased likelihood of the adverse effect. So bolus administration is not recommended for this medication. Number 22. The nurse is teaching a client newly diagnosed with ulcerative colitis about dietary management. Which food should the client avoid during an acute flare-up? A, white rice. B, grilled chicken. C, fresh fruits and vegetables. D, boiled potatoes. The answer is letter C. We know that high fiber foods such as fresh fruits, vegetables are irritants. This is not going to help whenever there is inflammation of the bowel. This can only exacerbate diarrhea. It can also cause abdominal pain. So you need to avoid these foods, or you teach the patient to avoid these, especially during periods of flare-ups. Now, we have letter A as one of the incorrect options here. White rice is a low residue food, which is basically easy to digest, and less likely to irritate inflamed bowel during an acute flare-up. Now, letter B, grilled chicken is a good source of protein that is gentle on the digestive system. It does not worsen symptoms. We have letter D, boiled potatoes, which are also considered as low residue food that is safe to consume during an acute flare-up. 23. The nurse performs a Shvastik sign assessment on a client and observes facial twitching on the same side. This finding indicates which of the following: A, hypernatremia, B, hypocalcemia, C, hyperglycemia, and D, hypokalemia. The answer is hypocalcemia. This is going to lead to neuromuscular excitability, leading to Shvastik sign, which is the facial twitching, and this is a hallmark sign of low calcium levels. Now, we have letter A as one of the incorrect options. The hypernatremia is going to typically present with neurological symptoms such as irritability, could be confusion, could be lethargy, but not muscle twitching. Letter C is another incorrect option. We know that hyperglycemia is not associated with the muscle twitching such as Shvastik sign, and the symptoms in hyperglycemia typically can include the increased urination, polydipsia, and fatigue. So you got to discard this option. For letter D, another incorrect option, hypokalemia can lead to muscle weakness. It can cause cramping, can also lead to cardiac arrhythmias, but it will not lead to a positive Shvastik sign. Number 24. A 45-year-old female with type 1 diabetes is concerned about her blood sugar levels and asks her healthcare provider about the cause of her high morning readings. The provider considers the possibility of either the Simoji effect or the dawn phenomenon. Which statement accurately distinguishes the two phenomena? A, the Simoji effect is caused by nighttime hyperglycemia, whereas the dawn phenomenon is caused by nighttime hypoglycemia. B, the Simoji effect involves hypoglycemia during the night, followed by rebound hyperglycemia in the morning, whereas the dawn phenomenon is a result of hormonal release. C, the dawn phenomenon occurs at random times during the day, whereas the Simoji effect always occurs at night. And D, the Simoji effect can only occur in clients with type 2 diabetes, whereas the dawn phenomenon affects clients with type 1 diabetes. The answer to this question is letter B. The Simoji effect can result from the low blood sugar at night, and it will trigger a counter-regulatory hormone response that will cause high blood sugar in the morning. Now, for the dawn phenomenon, this is caused by natural hormonal surges related to growth hormone, the cortisol, adrenaline during the night, which can lead to morning hyperglycemia. So your clue in answering this test question is to focus on the time frame, which is night, and the mechanism. So we have hormonal versus hypoglycemia when differentiating the two phenomena. So what you need to do here is to eliminate options with incorrect definitions or unrelated statements about the diabetes type. Now, A is an incorrect option here because this is reversing the definition, the Simoji and the dawn phenomenon. And letter C is another incorrect option. We know that dawn phenomenon and Simoji effect are specific to morning hyperglycemia and do not occur randomly. Letter D is another incorrect option because both phenomena are primarily observed in clients with type 1 diabetes, but can also occur in type 2 diabetes. We have number 25. A client with a femoral vein catheter is complaining of itching under the dressing. Which of the following actions should the nurse take first? A, replace the dressing using sterile technique. B, reassure the client and document the complaint. And C, assess the site for redness, swelling, or drainage. And D, instruct the client to gently scratch around the dressing. take note about the question. Which of the following actions should the nurse take first? Your answer should be letter C. We know that itching can indicate irritation or the early stages of an infection. So you have to do a thorough assessment in order for you to determine the next appropriate intervention. Now, again, you are being asked about a first action. So you have to prioritize assessment before doing an action when a client reports a symptom. So you have to eliminate options that skip assessment or promote unsafe practices. For letter A, another incorrect option here. We know that replacing the dressing may be necessary, but assessment should always occur first to identify potential complications such as infection or irritation. Letter B is also an incorrect option because reassurance and documentation alone do not address the possibility of infection or catheter-related complications. For letter D, which is another incorrect option here, the scratching can increase the risk of contamination and infection, especially in the presence of a central venous catheter. And so, we are inviting you again to enroll to our NCLEX course and visit us at nclex-coaching.com for more details. Question is, which of the following is the priority assessment for the nurse to perform before a lumbar puncture? A, checking the client's coagulation studies. B, assessing the client for signs of restlessness or confusion. C, confirming the presence of a signed informed consent. D, measuring the client's body temperature. The answer is letter B. B is correct because restlessness or confusion could indicate increasing intracranial pressure, which is a critical contraindication for this procedure. And I want you to take note that when performing a lumbar puncture in the presence of an elevation of the ICP can also increase the risk of brain herniation, which is a life-threatening complication. Now, letter A is an incorrect option here. The checking of the coagulation studies is important to reduce the risk of bleeding complications, but this does not take precedence over ruling out increased ICP. For option letter C, confirming the signed informed consent is a routine part of the pre-procedure preparation, but is not the most critical safety assessment. And for letter D, which is another incorrect option, the measurement of the body temperature is essential to identify infection, but it is not a contraindication for the procedure. So take note, our option here should be letter B. Number 27. Which client statement most likely indicates alcohol use disorder? A, I only drink during the weekends. B, I've tried to stop drinking several times, but I always start again. C, I drink only with meals to help with digestion. And D, I have never missed work due to drinking. The answer here is letter B. If there's repeated unsuccessful attempts to quit drinking, this is a hallmark of alcohol dependence and a key diagnostic feature of alcohol use disorder. So you have to focus on the diagnostic criteria: dependence, unsuccessful attempts to quit, and continued use despite consequences are key indicators of alcohol use disorders. For letter A, this is an incorrect option. Drinking only on weekends may indicate social drinking, not necessarily a disorder unless it involves dependence or negative consequences. Letter C is also incorrect because drinking with meals alone does not confirm alcohol use disorder unless paired with dependence or harmful effects. The same thing with letter D, another incorrect option. Not missing work does not rule out alcohol use disorder, and many individuals with the condition maintain functional responsibilities. Let's have question number 28. The nurse is caring for a pregnant client in her first trimester diagnosed with hyperthyroidism. Which medication does the nurse anticipate the healthcare provider will prescribe? A. Methimazole. B. Propylthiouracil or PTU. C. Propranolol. D. Radioactive iodine. The answer is letter B. PTU, or the propylthiouracil, is the preferred medication during the first trimester because it has a lower teratogenic risk compared to methimazole. So in this type of question, always consider pregnancy safety when choosing medication, and you need to eliminate options that are contraindicated in pregnancy, especially the radioactive iodine. Now for letter A, methimazole, this is already teratogenic and it should be avoided in the first trimester, but may be used in the second and third trimesters. For letter C, this is an incorrect option because the propranolol is used to manage symptoms of tachycardia, but does not treat hyperthyroidism. And letter D, another incorrect option. The radioactive iodine is contraindicated in pregnancy due to the harmful effects on the fetus. Again, take note about our case. This is asking about a case of a pregnant client in the first trimester of pregnancy. Number 29, a client with bacterial meningitis is scheduled for a lumbar puncture. Which action should the nurse prioritize before the procedure? A. Administering prescribed broad-spectrum antibiotics. B. Ensuring strict aseptic technique is followed during the procedure. And C. Educating the client about the need for informed consent. And D. Monitoring for signs of increased intracranial pressure. The answer is letter D. The increased ICP is a contraindication for lumbar puncture because this procedure could cause brain herniation, and this assessment directly addresses client safety. This is quite similar to the prior question that we just had. Now, option letter A is incorrect because administering antibiotics is essential to treat meningitis, but does not take precedence over ruling out contraindications for the lumbar puncture. Letter B, ensuring strict aseptic technique is also important during the procedure, but is not the priority pre-procedure action. And for letter C, informed consent is necessary for legal and ethical reasons, but does not address the immediate safety risk. Number 30, a nurse is educating a client with dysphagia about aspiration precautions. Which statement by the client indicates a need for further teaching? A. I will remain seated upright for 30 to 60 minutes after eating. B. I will chew my food thoroughly before swallowing. And C. I will tuck my chin down when I swallow to protect my airway. And D. I will tilt my head back slightly to make swallowing easier. The answer here is letter D, because tilting the head back increases aspiration risk by opening the airway and making it easier for food or liquids to enter the trachea. So instead, a chin tuck position should be used to protect the airway during the swallowing. So you're going to look for the client statements that contradict standard safety measures, especially in this case. Now, letter A is incorrect. Sitting upright after meals minimize the risk of aspiration, and this is a correct precaution. So that's why we are going to eliminate this. And letter B as well, because chewing food thoroughly before swallowing will help reduce choking and aspiration risk. And for letter C, tucking the chin down while swallowing can reduce the aspiration risk by helping to close the airway. So take note about our case. This is about a patient with dysphagia with aspiration precautions. Again, don't forget these basics in observing the precautions. Make sure your patient should be sitting upright. Make sure that they tuck their chin before they're swallowing. And make sure that they chew their food before they swallow the food content. And also to instruct the patient not to tilt their head backwards, because this can open the airway. So make sure that you have these key components in the aspiration precautions. Number 31, a nurse is assessing a client with suspected alcohol dependence. Which finding would be most concerning? A, the client drinks only during social events. B, the client has had multiple unsuccessful attempts to quit drinking. C, the client drinks 1 glass of wine with dinner daily. And D, the client started drinking at age 30. The answer is letter B. Multiple unsuccessful attempts to quit drinking are hallmark signs of alcohol dependence and a key diagnostic criterion for alcohol use disorder. And this indicates the client is struggling to control their drinking behavior. And here in this question, you focus on the keyword most concerning. Alcohol dependence involves behavioral indicators like failed attempts to quit and loss of control over drinking. So you need to eliminate those options that lack strong evidence of dependence. Now for the incorrect answers, here we have letter A. Social drinking does not necessarily indicate dependence unless it leads to excessive intake or functional impairments, and this option lacks evidence of problematic behavior. For letter C, moderate alcohol intake, such as 1 glass of wine with dinner, is considered within normal consumption guidelines and will not indicate dependence. For D, the age of onset of drinking is not inherently concerning without evidence of harmful patterns. Number 32, which client statement indicates a need for further teaching about the dawn phenomenon? A, I might need an insulin adjustment to cover the early morning hours better. B, this condition occurs because of the hormones released at night. C, eating a large snack before bedtime will help prevent morning hyperglycemia. And D, intermediate acting insulin given later in the evening might help manage this. Again, the question is about pointing out an indication of a statement indicating a need for further teaching about dawn phenomenon. The answer is letter C. Eating a large bedtime snack does not prevent morning hyperglycemia caused by the dawn phenomenon, and this misconception may worsen blood sugar control. So in this question, you have to identify the incorrect statement among accurate ones. So focus on the pathophysiology of the dawn phenomenon, which is driven by hormonal surges, not hypoglycemia. And so for letter A, which is an incorrect option, the insulin adjustment is an appropriate intervention for managing the dawn phenomenon and demonstrates understanding. And for letter B, hormonal changes such as increased growth hormone and cortisol secretion are the primary cause of the dawn phenomenon, making the statement accurate. And D, adjusting the timing or type of insulin is a common strategy to address this condition. That's why you have to eliminate option D as well. 33. A nurse is providing discharge teaching to a client prescribed metoclopramide. Which statement by the client indicates a need for further teaching? A, I may feel sleepy after taking this medication. B, if I experience fever or muscle stiffness, I should call my doctor immediately. And C, I will avoid driving until I know how this medication affects me. And D, I can take this medication for as long as I need it to control my symptoms. Again, we're looking for that inaccurate or a misunderstanding or statement that reflects misunderstanding. The answer should be letter D, because long-term use of metoclopramide can lead to serious side effects such as tardive dyskinesia, and it should only be used for the shortest duration necessary under close supervision. So in this question, you focus on the risks of prolonged use for drugs like metoclopramide and choose the option that conflicts with safe medication practices. Now, letter A is an incorrect option because drowsiness is a common side effect of metoclopramide, and recognizing this demonstrates understanding. For B, another incorrect option, this is a sign of neuroleptic malignant syndrome, and it is a rare but is serious adverse effect, and the client should know to seek immediate attention right away when they encounter this. Now, for letter C, another incorrect option, avoiding driving until the effects of metoclopramide are known is a safety precaution, and this also reflects understanding. 34. The nurse is caring for a client with a vaso-occlusive event secondary to sickle cell disease. Which intervention should the nurse prioritize? A, administering oxygen to maintain saturation of greater than 92%. B, encouraging the client to ambulate frequently. And C, applying cold compresses to painful joints. And D, providing hypotonic or isotonic fluids intravenously. The answer is letter D. Hydration is critical to reduce blood viscosity and prevent further sickling, and will improve perfusion during a vaso-occlusive event. And here we are going to expect administration of IV fluids such as hypotonic, half normal saline solution, or isotonic 0.9% normal saline, which is very critical to improve perfusion. And here we're going to focus on interventions that directly address the root cause of a vaso-occlusive event. So hydration is going to be our priority to reduce sickling and to improve blood flow. For letter A, this is an incorrect choice. Oxygen is important for clients with hypoxia, but is not the primary intervention unless oxygen saturation is compromised. Now we have letter B, another incorrect option. Frequent ambulation during a VOE can increase the pain and stress on the body. And so what we should be doing here is to promote rest and hydration, not encouraging the client to ambulate. For letter C, this is another incorrect option. Cold compresses are contraindicated because they can cause vasoconstriction, which can worsen the crisis. So what you should do here instead is to apply warm compresses to promote vasodilation. 35. Which of the following findings during a pre-procedure assessment for a lumbar puncture would require the nurse to notify the healthcare provider? A, the client reports mild back pain. B, the client has a petechial rash on their trunk. And C, the client exhibits confusion and altered mental status. And D, the client's temperature is elevated at 100.4 degrees Fahrenheit. The answer is letter C. This is quite similar to the prior question that we had. Confusion and altered mental status may indicate increased intracranial pressure, which is a contraindication for the lumbar puncture due to the risk of brain herniation. Now, letter A, mild back pain is not a contraindication for procedures like lumbar puncture, and this can be managed with comfort measures. And for letter B, another incorrect option, petechial rash could suggest bacterial meningitis and typically requires a lumbar puncture to confirm the diagnosis. And for letter D, a mild fever of 100.4 Fahrenheit is not a contraindication, but should be noted as it may indicate infection. 36. A client with type 1 diabetes reports morning blood glucose levels consistently above target. The nurse suspects the dawn phenomenon. Which diagnostic approach would help confirm this? A, checking blood glucose levels at 2 to 3 a.m. for hypoglycemia. B, monitoring blood glucose levels hourly from midnight to 6 a.m. And C, recording the client's dietary intake for 3 days. And D, comparing morning glucose levels before and after insulin adjustments. The answer is letter B. Monitoring the glucose levels hourly during the night can help differentiate between the dawn phenomenon and the Sumoji effect, wherein the blood glucose drops and then rebounds. So here you have to look for the specific diagnostics that can confirm the suspected condition. And in this case, monitoring blood glucose during the night will directly address whether the issue is either dawn phenomenon or the Sumoji effect. For letter A, this is an incorrect option. Checking the blood glucose levels at 2 to 3 a.m. for hypoglycemia is useful to assess for the Sumoji effect, where the blood glucose drops during the night, causing rebound hyperglycemia, and this approach does not confirm the dawn phenomenon. For C, it is another incorrect option because recording dietary intake is important for the overall management of diabetes, but it does not directly help differentiate between the dawn phenomenon and other causes of morning hyperglycemia. Letter D, another incorrect option. Comparing the morning glucose levels before and after insulin adjustments will help assess insulin therapy effectiveness, but does not directly confirm the dawn phenomenon. 37. A client with a thyroid storm is prescribed both propylthiouracil and propranolol. What is the rationale for including propranolol in the treatment? A, to reduce thyroid hormone production. B, to manage symptoms like tachycardia and hypertension. C, to block the absorption of iodine in the thyroid gland. And D, to prevent the risk of hepatic damage from PTU. The correct answer is letter B. Propranolol is included to treat cardiovascular symptoms in thyroid storm and specifically indicated for the tachycardia and hypertension. And this is to block the beta receptors and slowing the heart rate. For letter A, one of the incorrect options, propranolol does not reduce thyroid hormone production rather. It is classified as a beta blocker that works to manage adrenergic symptoms such as tachycardia and hypertension. Letter C is also incorrect because propranolol does not block iodine absorption in the thyroid gland, and that role is typically fulfilled by other medications like iodine solutions or radioactive iodine therapy. D is also incorrect because propranolol does not prevent hepatic damage caused by the PTU, and this is more related to PTU side effects and monitoring liver function during therapy. Now, we are inviting you again to enroll to our NCLEX course via Stancoast, nclex-coaching.com, so kindly pay us a visit. Now, let's proceed to question number 38. The nurse evaluates a treatment plan for a client with a vaso-occlusive event secondary to sickle cell disease. Which finding indicates improvement? A, blood pressure increases to 140/90 mmHg. B, client reports pain decreasing from 9 out of 10 to 4 out of 10. C, increased respiratory rate of 24 breaths per minute. And D, hemoglobin decreases from 12 grams per DL to 10 grams per DL. The answer is letter B, because a decrease in pain can be a very significant indicator in the improvement of the vaso-occlusive event. And we know that pain management is a central aspect of the treatment. So in this question, you have to look for direct measures of improvement related to the condition. And in sickle cell disease, pain relief is a primary outcome, making a decrease in pain the best indicator of improvement. For letter A, this is incorrect because the blood pressure is not a key indicator of improvement in a vaso-occlusive event. And hypertension could indicate another problem. This is a high reading right here, 140/90. Letter C is incorrect. An increase in the respiratory rate can indicate issues with pain, could be dehydration, hypoxia, all of which would suggest that the treatment is not effective managing the crisis. For letter D, another incorrect answer or option, a decrease in the hemoglobin could indicate worsening anemia or possibly hemolysis, which is common in sickle cell disease, but it does not suggest an improvement of the VOE. 39. A client with an alcohol use disorder is being evaluated for other conditions. Which comorbidity is a client most likely to have? A. Schizophrenia. B. Antisocial personality disorder. C. Bipolar disorder. And D. Attention deficit hyperactivity disorder. The answer is letter B. The antisocial personality disorder is often seen in clients with alcohol use disorder due to impulsivity, disregard for rules, and a history of behavioral issues. So what you need to do here is to understand that co-occurring mental health disorders common with alcohol use disorder. And so antisocial personality disorder is the most commonly associated psychiatric comorbidity. For letter A, this is an incorrect option because it's not commonly associated with alcohol use disorder in the way antisocial personality disorder is. For C, we know that bipolar disorder can coexist with alcohol use disorder, but it's less prevalent in comparison to antisocial personality disorder in clients with alcohol abuse. And letter D, ADHD is not as commonly associated with the alcohol use disorder as antisocial personality disorder. And though some people with ADHD may have substance abuse issues. 40. A client with aspiration precautions has a pulse oximetry applied during meals. The nurse should take immediate action if A. The pulse oximetry reading drops by 2% from baseline. B. The client reports feeling tired halfway through the meal. And C. The client requests additional salt and pepper for their food. And D. The client takes small, slow bites during the meal. The answer is letter A. The drop or a drop in the pulse oximetry reading during a meal may indicate aspiration, which can lead to respiratory complications such as pneumonia. And so you have to immediately act on this one to assess for aspiration and prevent further complications. So again, that's going to be a 2% drop from the baseline reading. The other options, such as B, is incorrect. Fatigue during a meal is not an immediate indicator of aspiration risk, and this could be related to respiratory function. Letter C is another incorrect option. The request for additional salt and pepper is unrelated to aspiration risk. It may indicate a preference, but does not signal for any immediate intervention. D, another incorrect option. Taking small, slow bites is recommended technique to minimize aspiration risk, but this behavior is not concerning and does not require immediate intervention as well. Let's have number 41. A client with a history of hypocalcemia is admitted to the unit. Which clinical signs should the nurse prioritize during the assessment? A. Palmar flexion and hyperreflexia. B. Bradycardia and pallor. C. Edema and orthostatic hypotension. D. Numbness and tingling in the extremities. The answer is letter D. These are the hallmark symptoms, especially early symptoms of hypocalcemia due to neuromuscular irritability, and these indicate the need for further assessment, including tests for trisukine and shivastixine. And for the other options, A, B, and C, these are incorrect. The palmar flexion and hyperreflexia, these are associated with hypocalcemia, but they are specific findings that are part of a broader neuromuscular symptoms. And these are not the most generalizable or prioritize symptoms to assess for first. Letter B, bradycardia and pallor. These are not typical signs of hypocalcemia, and these may indicate cardiac or perfusion issues unrelated to calcium deficiency. Now, letter C. These are not linked to hypocalcemia, but are more common in fluid balance disorders and cardiovascular issues. 42. A nurse is caring for a client with hypocalcemia. Which intervention should the nurse prioritize in the client's care plan? A. Encourage weight-bearing exercises. B. Administer calcium supplements as prescribed. C. Monitor for bradycardia and hyperthermia. And D. Provide a high-sodium diet. The answer is letter B. This is the most direct and effective intervention for managing hypocalcemia. And you have to look for that intervention that directly treats the root cause of the condition. And again, you have to administer the calcium supplement. Now, for the other options, such as A, this promotes long-term bone health, but it does not address the immediate need to correct the calcium deficiency. So eliminate this one. For letter C, these are not specific concerns in hypocalcemia. We know that cardiac monitoring is important, but typically for symptoms like arrhythmias or muscle spasm. Now, for letter D, provide a high sodium diet. We know that sodium levels do not directly affect calcium levels, and this intervention does not address hypocalcemia. Let's have number 43. The nurse is caring for a client receiving metoclopramide for gastroparesis. The nurse should question the administration of this medication in which client? A client with nausea due to chemotherapy. B, a client with a history of seizures. C, a client with gastroparesis secondary to diabetes mellitus. And D, a client with post-op ileus. The answer is letter B, because metoclopramide lowers the seizure threshold, and this can increase the risk of seizure activity. And this is something that you should question, okay, in clients with a seizure history. Now, letter A is one of the incorrect options. The metoclopramide is commonly used to treat nausea, including that is associated with chemotherapy. And letter C is another incorrect option. Metoclopramide is effective for managing diabetic gastroparesis. And for letter D, this medication can also help stimulate gastric motility, and it's often used in this type of cases. Again, look for that option that you should question. Number 44. Which client statement about metoclopramide indicates the need for immediate follow-up by the nurse? A, I feel very sleepy after taking this medication. B, I'm having loose stools more often than usual. C, my jaw feels tight and my neck feels stiff. And D, I have been sweating a lot and feel very hot. The answer is letter D. Sweating and feeling overheated are hallmark signs of neuroleptic malignant syndrome, and which is a fatal condition characterized by the hyperthermia, autonomic instability. There's also altered mental status and muscle rigidity. So in this case, you really have to watch for early signs so we can treat this early on and to prevent further complications. Now, letter A is one of the incorrect options. Drowsiness is a common side effect of metoclopramide, and it doesn't require immediate intervention. And B, increased bowel movements may occur due to the prokinetic effects of metoclopramide, but it is not a critical concern. For letter C, this is identified as an extrapyramidal symptoms, or APS, which although is serious, but immediately less life-threatening compared to the neuroleptic malignant syndrome. Okay, we know that the EPS can be treated promptly with medications like diphenhydramine or possibly the benztropine, but it doesn't take precedence over the emergent management required for the neuroleptic malignant syndrome. 45. A nurse is caring for a client with a recently placed femoral vein catheter. Which of the following instructions is the most important to include in the teaching? A. Clean the site daily with soap and water. B. Refrain from elevating the head of your bed beyond 45 degrees. And C. Avoid drinking fluids unless directed by your healthcare provider. And D. Remove the dressing if it becomes itchy or uncomfortable. Your answer should be letter B. Limiting head of bed elevation reduces the risk of catheter-related complications, including dislodgement, bleeding, or hematoma formation. So in this question, you identify the intervention that prevents the most critical complication, and in this case, catheter dislodgement or bleeding. So your task here is to eliminate those distractors that do not address the femoral vein catheter specific risk or involve inappropriate self-care actions. And so letter A is one of the incorrect options. Cleaning should follow sterile procedures using antiseptics like chlorhexidine, not soap and water. So eliminate this option. Letter B is another incorrect option. Fluid restriction is not typically required for femoral vein catheters unless specifically ordered. And letter D is also incorrect because clients should never remove their catheter dressing without professional assistance, as this action can compromise their safety and increases the risk of complications. 46. A 58-year-old client is admitted to the intensive care unit with severe pancreatitis. The client is unable to tolerate oral or enteral nutrition and has been receiving total parenteral nutrition with fat emulsions for the past 5 days. Which laboratory test should the nurse monitor most closely for this client? A. Complete blood count. B. Liver function tests. C. Blood urea nitrogen, and D. Electrolyte panel. The answer is letter B, because the TPN and fat emulsions are metabolized by the liver, and when used for long term can lead to complications such as hepatic dysfunction or fatty liver disease. And so the checking of the LFTs can provide you critical information of how the liver is tolerating the nutrient load. And for this type of question, you have to select that test. You have to prioritize that test that monitors specific organ systems affected by the treatment. And so recognize that TPN has a significant impact on the liver function, and it makes the liver function test the most critical to monitor. For A, this is an incorrect option. A CBC can be important for monitoring overall health, but it is not specific to complications related to TPN or fat emulsions. Letter C is another incorrect option. The BUN levels can monitor the kidney function and hydration status, but not directly impacted by the TPN. Also with letter D, another incorrect option. Electrolytes are also important to monitor for TPN therapy, but are not as specific as the liver function test when assessing for potential liver complications. 47. The nurse is assessing a client with ulcerative colitis. Which of the following would most likely be included in the client's clinical presentation? A. Projectile vomiting. B. Frequent bloody stools. C. Periumbilical bruising. And D. Absent bowel sounds. The answer is letter B, because ulcerative colitis is an inflammatory bowel disease primarily affecting the colon, also the rectum, which can lead to frequent bloody stools due to mucosal ulceration. Now, your clue in this test question is the link hallmark symptoms with the disease process. So for an ulcerative colitis, you have to focus on inflammation and mucosal damage leading to bloody diarrhea. So you have to eliminate those options unrelated to GI function. So letter A, projectile vomiting, is more associated with pyloric stenosis or increasing intracranial pressure. So eliminate that. Letter C, periumbilical bruising. This is what we call as Cullen sign. It is the hallmark of pancreatitis or an intra-abdominal bleeding, but not ulcerative colitis. Letter D, absent bowel sounds. This is also incorrect. What you should be hearing will be high-pitched bowel sounds or diarrhea, and that's typical in ulcerative colitis. 48. The nurse is monitoring a client with ulcerative colitis. Which lab finding would be most concerning? A, hemoglobin of 9 grams per dl. B, potassium level of 4.0 milliosmoles per liter. C, white blood cell count of 8,000 microliter. D, albumin level of 4.5 grams per dl. The answer is letter A, because that value indicates anemia and often caused by the chronic blood loss from frequent bloody stools in ulcerative colitis, and this can lead to fatigue and other complications. So here you need to prioritize abnormal findings linked to common complications of the condition. And we have option letter B, which is an incorrect option. That level is within normal limits. And we know that hypokalemia could occur with severe diarrhea, but it's not shown here. Now, for letter C, another incorrect option, because this value is within the normal range. We know that an elevated white blood cell count could indicate infection or inflammation, but are not present in this scenario. Letter D is also incorrect because that albumin value is within the range of 3.4 to 5.4 grams per dl. And just to give you a little bit of review, hypoalbuminemia might indicate malnutrition, which is a concern in severe form of ulcerative colitis. But again, this value does not require intervention this time. 49. The nurse is teaching a client about strategies to manage dawn phenomenon. Which statement by the client indicates successful teaching? A, I will increase my morning insulin dose to counteract this problem. B, I will take my evening insulin later at night to prevent early morning hyperglycemia. And C, I should avoid exercising before bedtime to prevent this condition. And D, this condition is caused by not eating enough carbohydrates in the evening. The answer is letter B. The phenomenon results from early morning surges in growth hormone and cortisol, which can increase the glucose production, and delaying the evening insulin dose provides better glucose control during this period. Let's have number 50. The nurse observes a newly hired registered nurse prepare to administer NPH insulin to a client. Which action demonstrates proper handling of the insulin vial? A, shaking the insulin vial vigorously before administration. B, gently roll the insulin vial between the hands to mix. And C, storing the insulin vial in the freezer before administration. And D, drawing up the insulin immediately without mixing it. The answer is letter B. The NPH insulin is a suspension that must be gently rolled to ensure even distribution of the insulin particles. And in this test question, what you are supposed to do is to focus on a safe medication administration practice. So you have to recall that NPH insulin is a suspension, and this will require gentle mixing, not shaking, not freezing. And letter A, of course, is an incorrect option because shaking the vial vigorously can introduce air bubbles. It can cause dosing inaccuracies. For letter C, insulin should not be frozen because it can compromise its efficacy. And letter D, NPH insulin must be mixed properly before administration to ensure accurate dosing. You have to check out our website at nclex-coaching.com. Is the nurse is educating parents on newborn thermoregulation. Which of the following actions would help prevent evaporative heat loss in the newborn? A, covering the newborn's head with a hat. B, keeping the newborn away from drafts. C, drying the newborn immediately after delivery. And D, placing the newborn on a warm radiant warmer. The answer is letter C. Evaporative heat loss occurs when there's moisture on the newborn skin and it evaporates. This can cause cooling. And so drying the newborn immediately removes this moisture and is essential to preventing evaporative heat loss and making it the best choice. So you have to recognize the keywords evaporative heat loss and associate it with moisture evaporation. So what you're going to do here is to eliminate options that prevent other types of heat loss, such as radiation or convection. So letter A is something that you should discard right away because covering the newborn's head prevents heat loss via radiation, not evaporation. And recall that radiation occurs when the heat is lost from the newborn to cooler surroundings, such as air or objects nearby. B is something that you have to discard as well because keeping the newborn away from drafts prevents convective heat loss, which occurs when heat loss is lost due to air movement across the skin. And D is also an incorrect option. Placing the newborn under a radiant warmer helps prevent heat loss via radiation, but does not address evaporative heat loss. 52. Before administering NPH insulin to a client, the nurse checks the client's blood glucose level. The level is 60 milligrams per deciliter. What should the nurse do next? A, administer the insulin as prescribed. B, administer a quick-acting carbohydrate and recheck the blood glucose in 15 minutes. C, ask the client when they last ate and proceed with the insulin injection. And D, hold the insulin dose and document the blood glucose level. The answer is letter B. A blood glucose of 60 milligrams per DL is indicating hypoglycemia, which requires you to take immediate intervention with giving the client a quick-acting carbohydrate. Could be a juice or glucose tablets. And you have to recheck the blood glucose 15 minutes later to ensure the hypoglycemia is corrected before proceeding with insulin administration. And most often when the patient has had a hypoglycemic event, you have to keep an eye on this patient, and most of the time if the blood glucose is not really coming back to the normal range, you have to make sure that the healthcare provider is notified. And most of the time, the insulin dosing will be adjusted to ensure that the patient will not have another hypoglycemic event. So in this test question, you have to prioritize safety and emergency interventions when abnormal values are presented. So a blood glucose level that is below 70 milligrams per DL typically signals hypoglycemia. And again, don't forget to take immediate treatment with the use of the simple carbohydrates. For letter A, which is an incorrect option, administering the NPH insulin when the blood glucose is 60 milligrams per DL could exacerbate the hypoglycemia and can lead to severe consequences, maybe seizures or possibly loss of consciousness. For letter C, although knowing the last meal is important, addressing the immediate hypoglycemia is a priority here. And insulin should not be administered until glucose levels normalize and stable. Option D is another incorrect option because documenting the glucose level is necessary, but the nurse here must first take action to treat the hypoglycemia. And so holding the insulin dose without addressing the low blood sugar level does not ensure client safety. So keep this in mind. 53. During a post-delivery assessment, the nurse notes that the newborn is exhibiting signs of cold stress. Which findings supports this assessment? A. Tachycardia and flushed skin. B. Hypoglycemia and mottled skin. C. Bradycardia and cyanosis. And D. Hypotonia and hyperglycemia. The answer is letter B, because cold stress leads to increased metabolic demands, can result in hypoglycemia and vasoconstriction, which will cause mottling or pale skin. So in this case scenario, you have to identify cold stress symptoms, focusing on metabolic and circulatory changes, such as hypoglycemia and vasoconstriction, and you have to eliminate those options suggesting hyperthermia or unrelated findings. So for letter A, tachycardia and flushed skin, these are manifestations of hyperthermia, overheating. This doesn't reflect cold stress. Letter C is also incorrect because bradycardia and cyanosis may occur in severe hypothermia but are not initial findings of cold stress. Letter D is another incorrect option. Hypotonia and hyperglycemia are unrelated to cold stress, and the cold stress typically causes hypoglycemia due to the body's effort to generate heat. The answer again for this item is letter B. 54. The nurse is educating a client about hypoglycemia symptoms to watch for after receiving NPH insulin. Which symptoms should the nurse include? A. Blurred vision, clammy skin, disorientation. B. Dry skin, frequent urination, weight loss. C. Increased thirst, dry mucous membranes, and polyphagia. And D. Fatigue, deep, rapid respirations, fruity breath odor. The answer is letter A. The symptoms of hypoglycemia include clammy or sweaty skin, blurred vision, disorientation, possibly shakiness, and dizziness. And so these clinical findings result from the brain and the body's response to low blood sugar. So in this test item, you got to match the questions focus on hypoglycemia with the appropriate physiological symptoms. So you have to eliminate choices associated with hyperglycemia or DKA. Letter B, one of the incorrect options here, reflecting dry skin, frequent urination, weight loss, are signs of hyperglycemia, not hypo. Letter C, another incorrect option. These are classic signs of hyperglycemia. Now, letter D, fatigue, deep, rapid respirations, or Kussmaul's breathing, along with the fruity breath odor. These manifestations suggest diabetic ketoacidosis, not hypoglycemia. 55. The nurse is teaching new parents about appropriate newborn care. What is the best way to prevent radiation heat loss in the newborn? A. Drying the newborn immediately after a bath. B. Using a radiant warmer after delivery. C. Avoid placing the newborn near cold windows or walls. And D. Keeping the room temperature at 25 degrees Celsius or 77 degrees Fahrenheit. The answer is letter C. Take note, we are being asked about preventing radiation heat loss. And letter C basically describes that the radiation occurs when the newborn's body loses heat to cooler objects in the environment, possibly windows or walls. And keeping the newborn away from cold surfaces is the most practical way to prevent radiation heat loss. Now, letter A is one of the incorrect options. Drying the newborn after a bath prevents evaporative heat loss, not radiation. B is also incorrect. Using a radiant warmer prevents radiation heat loss, but is not always feasible outside the delivery or nursery setting. And letter D, maintaining the room temperature helps with convective heat loss caused by air circulation, but it does not specifically prevent radiation. Let's have number 56. The nurse observes the newly hired registered nurse preparing an NPH insulin injection. Which action indicates the need for further education? A, using a 90-degree angle to inject insulin subcutaneously. B, rotating injection sites to avoid lipodystrophy. And C, administering NPH insulin 30 to 60 minutes before meals. And D, preparing NPH insulin without checking the expiration date. The answer is letter D, because this action isn't safe and expired insulin can lose potency and leading to poor glycemic control. So what you are tasked to do here is to focus on safety practices and also recognize that checking medication expiration dates is a universal nursing responsibility to ensure efficacy and patient safety. Now, letter A, it states here using a 90-degree angle to inject insulin subcutaneously. It does not require further teaching because insulin injections are typically administered subcutaneously at 45 degrees to a 90-degree angle when using an appropriate needle length. Also, B is something that you should discard. It does not require further teaching because rotating sites is very important to prevent lipodystrophy. And letter C, it does not require further teaching because NPH insulin is an intermediate acting insulin and should be given before meals to match its onset of action. 57. The nurse is discussing insulin site rotation with a client. Which statement by the client indicates a need for further teaching? A, I will rotate my injection sites to avoid lumps under the skin. B, I can inject insulin in the same spot daily as long as I alternate sides of my body. And C, common sites for insulin injection include the abdomen, thighs, and upper arms. And D, rotating sites helps the insulin absorb evenly. Again, look for that statement that indicates a need for further teaching. That is option B. This is an incorrect statement. Injection of the insulin at the same spot repeatedly can cause the lipodystrophy, and it will lead to uneven insulin absorption. So you got to pay attention to the keywords same spot daily, which indicate an incorrect practice. Letter A, this is an accurate statement, and there's no need for you to reinforce the teaching. The same thing with letter C and letter D. Let's have number 58. The nurse is caring for a 4-year-old client whose family adheres to Hindu dietary practices. The family requests that the client avoids beef and pork. Which of the following actions by the nurse demonstrates cultural competence? A, verifying the family's dietary preferences with the dietary department. B, offering fish or chicken from the hospital standard menu. And C, removing all meat items from the tray before delivering it to the client. And D, asking the family to provide detailed written instructions about their dietary restrictions. Letter A is the answer because this ensures the hospital provides meals aligned with the family's cultural and dietary needs without assumptions. So here you have to select the option that shows proactive nursing care to meet the client needs. And in this question, you have to avoid options that involve assumptions or transferring responsibility. So letter B is an incorrect option. You have to confirm with the family and the dietary department instead of assuming what is acceptable. Now, letter C is also an option that you should discard because this does not address preparation methods, cross-contamination, or specific dietary needs. And letter D is also incorrect because this shifts the responsibility to the family instead of the healthcare team actively addressing the concern. 59. A client experiencing an acute exacerbation of multiple sclerosis is receiving high-dose intravenous corticosteroids. Which nursing intervention is the priority? A. Monitor the client's blood glucose levels frequently. B. Hold the medication until all ordered cultures are obtained. And C. Provide the client with meals high in dietary sodium. And D. Consult with the healthcare provider about discontinuing the proton pump inhibitor. The answer is letter A, because corticosteroids interfere with glucose metabolism by reducing insulin action, and this can lead to elevation of the blood glucose level. So there is a need for us to do frequent glucose monitoring, and this is the priority to detect and also manage hyperglycemia early. And so if you had selected letter B, C, and D, these are all incorrect. Letter B, cultures are also obtained before antibiotics, not before administering corticosteroids. Letter C, corticosteroids can cause harm, or can cause sodium rather, to retain, and it will increase the risk of fluid overload and also hypertension. And so a low sodium diet is more appropriate. Now for letter D, another incorrect answer. The steroids increase gastric acid production, so making a proton pump inhibitor necessary to reduce the risk of GI ulcers. Again, your focus here is to look into the effects of the corticosteroids, especially high-dose corticosteroids, which can lead to hyperglycemia, sodium retention, and gastric irritation. And you have to eliminate those distractors. And so if an option contradicts the medication action, for example, increasing the sodium in the diet, you have to eliminate it immediately. 60. The nurse is assessing a newborn's risk for cold stress. Which newborn is at the highest risk? A full-term infant delivered via cesarean section. B, a preterm infant with a birth weight of 2.0 kilograms. And C, a newborn with a jaundice requiring phototherapy. And D, a full-term infant delivered vaginally. The answer is letter B. Preterm infants have underdeveloped thermoregulation with minimal subcutaneous fat and increased susceptibility to cold stress. So in this question, prioritize preterm infants, especially about thermoregulation risk because of their underdeveloped systems, which can place them at risk for cold stress. And if you selected letter A, this is incorrect because the cesarean section may delay thermoregulation, but full-term infants have better fat stores and thermoregulatory capacity. And for letter C, this is also an incorrect option. Phototherapy can slightly increase heat loss, but the risk is lower than in preterm infants. Letter D is also incorrect because full-term infants generally have better thermoregulatory mechanisms. Let's have number 61. The nurse works in a hospital unit that practices the primary nursing model. Which of the following is the best description of the nurse's role in this care delivery model? A, coordinating health services for clients to ensure cost-effective outcomes. B, delegating tasks to nursing assistants and supervising their work. C, taking total accountability for a client's care plan from admission to discharge. And D, supervising a team of healthcare personnel to provide client care. The answer is letter C. Primary nursing emphasizes continuity of care, where one nurse assumes full accountability for developing and also implementing the client's care plan throughout the hospital stay. And this is a type of model that can ensure a personalized approach and also will bring a strong nurse-client relationship. So you have to pay attention to the keywords like accountability, care plan from admission to discharge, which are hallmarks of primary nursing. So in this type of question, you eliminate choices that describe other care models like case management, functional, or team nursing. Let's have number 62. A nurse is assigned to care for 4 clients during their hospital shift and is responsible for providing all aspects of care without delegating any tasks to other team members. Which nursing care delivery model does this describe? A, functional nursing, B, primary care nursing, C, team nursing, D, case management. The answer is letter B, because in primary nursing, one nurse is responsible for all care for their assigned clients during a shift, providing direct care without delegation. And so the key phrase, without delegating tasks, indicates total client care. So in this question, you eliminate answers like functional or team nursing, which involves task delegation. Let's have 63. And so just a quick reminder for you to enroll to our NCLEX course. So kindly visit our website at nclex-coaching.com. We are resuming to item number 63. The nurse leads a team of healthcare workers, including another RN, an LPN, and a licensed assistive personnel to care for a group of clients during the shift. Which care delivery model is being implemented? A, functional nursing, B, case management, C, primary nursing, D, team nursing. The answer is letter D. Team nursing involves collaborative client care provided by a group of healthcare workers, and this is led by an RN. So this model also distributes responsibilities based on each team member's skills and scope of practice. So you have to focus on the keyword team in this scenario. So you have to eliminate those options like primary nursing or case management that do not involve collaboration with multiple staff. 64. A client with septicemia is receiving a broad spectrum antibiotic. Which laboratory result requires the nurse to notify the healthcare provider? A, the culture and sensitivity report shows resistance to the current antibiotic. B, the client's potassium level is 3.8 milliequivalents per liter. C, the urine culture demonstrates high sensitivity to the antibiotic. And D, the client's pulse oximetry reading is 94%. The answer is letter A. A culture and sensitivity report indicating resistance to the prescribed antibiotic means the medication is ineffective against that organism. And so the healthcare provider must be notified right away to change the antibiotic promptly to prevent worsening the infection. And so if you selected letter B, that is incorrect. That potassium level is within the normal range. It doesn't require immediate action. Letter C, high sensitivity in a urine culture is indicating that the antibiotic is effective and appropriate for the infection. And for letter D, a pulse oximetry reading of 94% is acceptable, and it shows that there is adequate oxygenation, and there's no need for us to notify the healthcare provider this time. And so what we need to do here is to look for the words resistant and sensitivity. We know that whenever there is that word resistant, something is wrong with the antibiotic. So this requires action, and also high sensitivity. The antibiotic is effective. So this is a good result. Let's have number 65. Which care delivery model emphasizes linking the client and their family to necessary services while promoting cost-effective outcomes? A, total client care, B, case management, C, team nursing, and D, functional nursing. The answer is letter B. Its case management involves coordination, care across the services. It can also ensure quality of care. It also promotes cost effectiveness. And so this is a model that is common in managing chronic conditions and also discharge planning. 66. A nurse is caring for a client in the emergency department who has undergone peritoneal lavage for abdominal trauma. Which interventions should be included in the client's plan of care? A. Palpate the client's bilateral femoral pulses. B. Evaluate for the presence of blood, bile, or feces. C. Collect a detailed dietary history from the client. And D. Perform Leopold's maneuver every 8 hours. The answer is letter B, because peritoneal lavage is a diagnostic procedure used to detect blood, also bile or feces in the abdominal cavity, and this will indicate internal bleeding or possibly organ injury. And so if these are found, a surgical intervention is often required immediately. Now, if you selected letter A, this is incorrect, because palpating the femoral pulses can assess blood flow to the extremities, but is not directly related to the purpose of the peritoneal lavage. For option letter C, collecting a dietary history is unnecessary in this case, especially in an emergency situation like abdominal trauma, where the priority is assessing for life-threatening conditions. Letter D, you have to eliminate this right away, because this is performed on a pregnant client to determine the fetal position, and there's no relevance to this step with regards to the scenario. So again, your focus here is on the purpose of the procedure. So take note, peritoneal lavage aims to detect blood, bile, or feces in the abdomen after a trauma. Number 67. A nurse is preparing a client for total hip replacement surgery. Which behavior by the client shows a need for additional pre-op teaching? A. The client inhales through the nose, exhales through the mouth, and engages the diaphragm and abdominal muscles. B. The client moves the feet in circular motions, dorsiflexes the feet, and flexes the toes. And C. The client uses an incentive spirometer by inhaling slowly and deeply, ensuring the piston rises to the preset volume. And D. The client sits upright in bed by lifting straight from the waist and swinging both legs to the side of the bed. Again, you have to select that option that will show or shows additional or shows a need for additional pre-op teaching, and that is no other than letter D. Why? Well, for a client after a total hip replacement, the proper way to get out of bed is to roll onto the side and use the side rail for support, and push up with one hand while carefully swinging the legs over the side of the bed. And so lifting straight up at the waist can risk dislocation of the hip joint. So we have our incorrect answers, items or options, letters A, B, and C. Letter A is the proper technique for deep breathing exercise. Letter B is also giving us an idea how to do the range of motion exercise like foot circles, dorsiflexion, toe flexing to prevent blood clots. And letter C, the use of incentive spirometer, using that slow, deep inhalation can ensure proper lung expansion, and this will also prevent atelectasis or pneumonia. 68. The nurse is caring for a client prescribed fondaparinux. Which of the following laboratory values is most important to monitor during therapy? A. Hemoglobin levels. B. Renal function tests. C. Activated partial thromboplastin time levels. And D. Platelet count. The answer is letter B, because this medication is primarily excreted through the kidneys, making renal function crucial to monitor. And so if there is going to be an impaired kidney function, this can lead to accumulation of this medication and will increase the risk of adverse effects. And so your task here is to recognize that this drug's pharmacokinetics involves renal excretion. So you have to eliminate those options unrelated to renal function or the drug's mechanism of action. Letter A is incorrect. Hemoglobin levels are not specifically affected by the fundaparinux therapy. Letter C is also incorrect because this medication does not significantly alter the APTT values because it does not interfere with the clotting factors measured by this test. And this is a medication that selectively can inhibit the factor 10A or activated factor 10 via the antithrombin without affecting thrombin or factor 2A. We have a letter D as one of the incorrect answers as well, because the platelet counts are not routinely monitored unless there is a specific concern for thrombocytopenia. 69. A nurse is caring for a client receiving fundaparinux. The client has a history of chronic kidney disease with elevated creatinine levels. Which action should the nurse take? A. Administer the medication as prescribed. B. Call the healthcare provider for a dose adjustment. C. Administer the medication with an additional dose of vitamin K. And D. Hold the medication and monitor APTT levels. Your answer should be letter B, because clients with renal impairment requires reduced dose of this medication or possibly discontinuation of this drug to avoid the accumulation and to prevent toxicity. We know that an elevated creatinine levels can compromise this patient, will lead to more adverse effect. Now, if you selected letter A, this is incorrect because administering without adjustments can lead to severe complications. Letter C is also incorrect because the vitamin K does not interact with fundaparinux and it's not used in the situation. Also, letter D is incorrect because APTT monitoring is unnecessary for this drug because it does not directly affect this clotting and also the clotting factors involved. Number 70. A nurse is reviewing a new medication order for fundaparinux for a client. Which client condition should prompt the nurse to question the order? A. The client is being treated for venous thromboembolism. B. The client is receiving prophylaxis for deep vein thrombosis after surgery. And C. The client has a history of hemophilia. And D. The client has been diagnosed with DVT. The answer is letter C, because this drug is an anticoagulant that increases the risk of bleeding and is contraindicated in clients with bleeding disorders like hemophilia. And so administering it in such cases can significantly increase the bleeding risk and would lead to severe life-threatening complications. And so if you select the letter A, venous thromboembolism is a common therapeutic indication for fundaparinux, and this can prevent clot propagation. And letter B is also an incorrect option here because fundaparinux is frequently used as a prophylaxis to prevent the DVT in post-op clients. And also letter D, it's also incorrect because this is a drug that is approved for treating and managing DVT. Number 71. A client receiving fundaparinux therapy reports dark, tarry stools. What is the nurse's priority action? A. Notify the healthcare provider immediately. B. Reassure the client that this is a common side effect. C. Administer a stool softener. And D. Increase the client's fluid intake. You've already seen the answer. The answer is A. The dark, tarry stools suggest GI bleeding, and it is a serious adverse effect of the anticoagulant therapy. And this requires prompt notification of the healthcare provider, which is essential to address potentially life-threatening condition. So you got to look for words indicating a serious or life-threatening condition, such as dark, tarry stools. 72. The nurse is teaching a client about funda parinux therapy. Which statement by the client indicates the need for further teaching? A, I will take this medication subcutaneously every day. B, I need to monitor my blood pressure regularly while on this medication. C, I should watch for signs of unusual bleeding or bruising. And D, I will stop taking the drug or medication if my stool turns dark or tarry. Again, look for that statement made by the client that indicates the need for further teaching. That is letter D. Because clients should never stop taking anticoagulant therapy without consulting their healthcare provider. As we know, that discontinuing the medication abruptly can increase the risk of thrombotic events. So what you should do instead, you're going to teach the patient to report concerning symptoms to the provider for guidance. So here you have to focus on identifying statements that reflects misunderstanding and look for options where the client is taking actions independently without proper input, especially with high-risk medications like anticoagulants. And so letter A, it shows understanding. The same thing with letter B and letter C. So eliminate these options. 73. A nurse is preparing to administer fundaparinux to a client with DVT. To ensure accurate client education, the nurse reviews the drug's mechanism of action. Which statement accurately describes how fundaparinux works? A, it inhibits platelet aggregation by blocking ATP receptors. B, it selectively inhibits factor 10A. C, it activates plasminogen to break down clots. And letter D, it directly inhibits thrombin. The answer is letter B. This is a drug that is synthetic anticoagulant that works by selectively binding to antithrombin 3, which can enhance its ability to inhibit activated factor 10. And so by blocking factor active 10, the medication prevents the conversion of prothrombin to thrombin. And so this will reduce the formation of blood clots. So if you selected letter A, this is incorrect because this describes the mechanism of action for the clopidogrel, which blocks ADP receptors to prevent platelet aggregation. And letter C, this is a description of thrombolytics like alteplase or TPA, which activate plasminogen to dissolve existing clots. Letter D is also incorrect because this describes direct thrombin inhibitors such as dabigatran, which inhibit thrombin activity directly. So you have to recall the different classifications of these anticoagulants or blood thinners, and because they really vary into the mechanisms. 74. A nurse is administering fundaparinux to a client. Which finding would require immediate intervention? A, creatinine level of 1.2 milligrams per dl. B, client reports mild injection site pain. And C, platelet count of 50,000 per cubic millimeter. And D, activated partial thromboplastin time of 30 seconds. The answer is letter C. This platelet count is low, critically low, and it is thrombocytopenia. This is a serious potential side effect of the anticoagulants like this fundaparinux, and you have to immediately intervene to prevent bleeding complications. So focusing into the labs would be your priority here to also identify abnormalities and to also keep safety for your patient. So what you have to do here is to eliminate normal or expected findings that do not warrant immediate action. Let's have 75. The nurse is assessing the nutritional status of a client with a history of cancer. Which tool is most appropriate to screen this client? A, Klein-Bell scale. B, Barthel index. C, Wong-Baker Faces Pain Rating Scale, and D, Patient-Generated Subjective Global Assessment, or known as the PG-SGA. The answer is letter D, because this is specifically designed for assessing the nutritional status of clients with cancer. So this is a combination of client self-reporting and clinical assessment to identify malnutrition and guide intervention. So in this test question, you have to match the tool to the purpose of the assessment and eliminate those options that are unrelated to nutrition or specific to different clinical concerns, such as ADLs or pain management. So what is in letter A? The Klein-Bell scale evaluates performance in activities of daily living. It does not assess nutrition. For letter B, this is also incorrect because this is supposed to measure independence in ADLs and mobility, not nutritional status. Letter C is also incorrect because this is a pain rating scale that is used to assess pain levels, not nutritional status. So you have completed the 3 sets of the questions. Again, we are inviting you to enroll to our NCLEX course by visiting our website at www.nclexcoaching.com. And we do appreciate your time completing these exercises. I hope that you have gained some important knowledge and also test-taking skills. And you know that completing the 75 questions is a very important step forward. And if you have that dedication and critical thinking, you are quite ready to conquer the NCLEX. So keep believing in your abilities. Your preparation and your perseverance will lead you to success on the NCLEX. Again, we thank you for your time in completing this episode. I'll see you again in the next video. Thank you. For the